Welcome back to From Fear to Fun, the podcast where we explore how to transform medical encounters with children from moments of fear into opportunities for fun, with connection, confidence, and cooperation. I'm so glad that you are here. Today's episode looks at a painful truth in medicine. We often experience interrupted communication with our patients, and the surprising part? It's not because we don't talk enough. It's because we talk too much and in the wrong way. In the last episode, we explored a foundational principle. Communication is judged by the recipient, not the sender. It doesn't matter how clear we think we are. What matters is what the patient hears, understands, and remembers. And when we look at the research, the picture is sobering. Communication between doctors and patients has been studied extensively. The results are grim. 50 to 80% of medical information is forgotten immediately. The more we say, the less is remembered correctly. Almost half of what is remembered incorrectly. And 30 to 50% of patients are non-compliant with medical advice, and for long-term treatments, adherence can drop to 30%. These numbers are not about patients' motivation. They are about communication failure, and that failure is ours. When I first learned these statistics, I was shocked. I had spent years trying to give more information, more explanation, more detail, more shared decision-making, more involvement. I wanted my patients and their parents to understand the problem. I wanted them to feel like active partners. But the outcome? I was exhausted. They were confused. And the communication was interrupted. Not because I didn't care, but because I was talking past their capacity to receive. The harder I tried, the worse it became. More words did not create more clarity. More detail did not create more understanding. More talking did not create more cooperation. Instead, I overwhelmed them. They forgot most of what I said. They remembered some of it incorrectly, and they were left unsure what to do next. This is not what any of us wants. So, what actually works? The lesson is simple. Effective communication is not about talking more, it is about talking better. Talking in a way the recipient can use. Talking in a way that fits their emotional state. Talking in a way that respects their cognitive load. Talking in a way that reduces fear instead of increasing it. Communication is not a download. It is a connection, and connection requires simplicity, clarity, and empathy. In a nutshell, we often experience interrupted communication with our patients. Most medical information is forgotten or remembered incorrectly. Talking more does not improve understanding, it often makes it worse. Effective communication means being better equipped, not more verbose. Our goal is to speak in a way the patient can actually use. When we shift from more information to better communication, we move from confusion to clarity and from fear to fun. Thanks for joining me on this episode From Fear to Fun. In our next episode, we'll take a closer look into the process of communication and some of the obstacles that are hidden here. Until then, keep noticing, keep wondering, and keep moving from fear to fun.